three of us who are speaking today are also spoke yesterday to a patient seminar, and it's I would assess it as by saying that one was a patient, one is another dentist, and then myself. It reinforced we're different, but we're the same. We each were diagnosed in a slightly different way. Our journeys have been different. And so what we're trying to do with these today's session especially is to draw out the common themes of what have we learned as clinicians from our experience that we can then translate into hopefully improved patient care. And I've already noticed in my interaction with patients is that when they realize, either because I've told them or they've learned otherwise, that I've been a patient too, it dramatically changes the relationship. It's very funny because quite often patients will come up to me and immediately say, "How are you doing?" And I laugh and I say, "No, I'm supposed to ask you that." So I think it brings a closer relationship. I mentioned before about hope, reducing anxiety. I think if they can really relate to the clinicians better, I think that's a dramatic improvement potentially. I think that it allows me to hopefully give information in a more personal way as well. Having had a few side effects of treatment, we can talk about those and strategies to get around them. I consider myself more of a watchdog quite often as my patients move through, because they don't all have oral complications. But I can now then talk to them about the other side effects and here, go talk to these folks, go do this, etc. So again, I'm not a care manager, but I can kind of act in that way with my patients. The preconceived thoughts about what is cancer and what's involved with cancer care, it can be emotionally and then subsequently mentally very debilitating. And I think if we can bring to our patients, here, you can do well. There are strategies, and again, this is the sort of, I think that's the most important message I bring, is that understanding and hope, and then seeing what potentially could happen. The old adage that doctors make the worst patients. I have to admit, I think I'm on the other extreme. I'm very much a sponge for taking all the help and support and trying to pay attention, do the right things, and do it on time, and those sorts of things. I think that, again, during the early period of the diagnosis and the very start of treatment, the unknown, and again, I mentioned the anxiety, etc., does, I think, potentially interfere with you smoothly working through the system. I think that education, understanding, making sense of the statistics, basically, for instance, about what's the potential benefits of this treatment, what's the prognosis. The bottom line is the odds could be 1 in 100,000, but if it happens to you, it's 100%. So how do we tell patients, well, we think that this treatment is going to provide this sort of benefit for you with this sort of prognosis, but there's no promises. So I think I think with the reassurance and hope, and this is, again, my doctors have been good about that with me, is that hope beyond the statistics. No, we can't guarantee that you're going to have 3 years of disease-free survival after transplant, but at least it's said in a way that's compassionate, it's caring, and that allows me to absorb that information and then keep moving ahead. I think the key issues would be to obviously understand, develop trust in your care providers, maybe have to unlearn some of your own messages and thoughts, and then put your hands in, hopefully, those care providers who are going to lead you further down the road, and obviously, hopefully, successfully. So I think that care providers are every bit as prone to everything else a non-medical patient is. Understand that, respect that, and work through those issues to allow yourself to interact with the care in such a fashion that you'll have the best outcome.